Okay, so an alternative way to tape if somebody's very sensitive and they're at home by themselves and they need to tape themselves, and their thumb is very sensitive, they had thumb surgery or they have some kind of pain that they report goes through here, even up the index finger, up their hand, and we want to unload this nerve right here, the superficial branch of the radial nerve. It's kind of hard to do this themselves, but you can make it where this will actually drop them over a little bit, give them some space in this location, and it should be very pain relieving. So we want them to take one piece that's probably half, around half the width, and then cut it into tiny little slits. The more sensitive, the smaller the slits need to be. Then you get them to roll it back. If they can't roll it, they can tear it, okay, just like this. And if our target is in this location, we want to make sure our piece of tape covers that. So I'm actually going to take this piece of tape and anchor it right below the joint. I'm going to pull that tape off very gently, but very carefully. Okay, this is how they do it themselves. And what I'm going to ask them to do is put their wrist back like this and anchor there. And then you pull this little piece off. Now, the key is if you can spread this tape, then they can spread it themselves a little bit, and then make their wrist drop down like so. There we go. And then rub it. And then when they relax, it will gently pull up and it'll lift that location that's very swollen. If they really like how that feels, you can get them to do it again with two smaller strips. Again, you pull it off. You anchor here. You get them to deviate again, like this. Anchor the end. And if you can spread them out, spread them out. A little tricky. There we go. And you've got them spread now, and you ask them to deviate again away. And if they can pick them up while they're in that position and spread them, that's even better. Then you get big high-low pressure gradients and a little bit more skin to attach to. Okay, so you've got that. So now they've got this extra nice lift. It's called a space correction and a lift. So you've got a positional correction and a space correction all in one. And then they can do the last one again. Remember, they are trying to do this themselves and follow what we tell them while we're getting through this time with telehealth. So bring this one again back here at an angle, sorry, like so. Stick that down and then ask them to go there. If they can bring it out again, that's good. Up like this. They don't have to stress too much about it if they can't get it. But to get the wrinkles out, get them to go on a stretch. Then just nice firm hold. And you have this nice positional correction that won't be sensitive there, and it should feel really good. So try that out. That will work on the Dequervains. It'll work on the distal radius fractures, the CMCs, even just general crush injuries or injuries to this side of the hand. But the target is the superficial branch of the radial nerve, the first dorsal compartment, and anything in that location. So it should feel pretty good. That's one for home.